There's no other place like this in Philly.
Inside a former Methodist church in the heart of Philadelphia's drug market, people suffering from drug addiction find dignity.
You come here, they look at you as a normal human being.
There's no preaching within these walls, just compassion and a path to recovery. At Prevention Point Philadelphia, meeting people where they're at is a hallmark of their treatment strategy, says Dr. Brian Work, the nonprofit's board chair.
You have to treat them with respect. Treat them as another human being. Just meet them as you would any other person in your life. That's so important because these people get so marginalized, they get so outside of our normal frame of reference that they're often treated not as human beings. And they don't expect to be treated in that fashion. When you don't have that kind of self-respect, it's hard to take care of yourself.
They don't look at you like you're a junkie or you're an addict. They help you with everything.
Everything includes providing health services and wound care, offering medicine-assisted drug treatment, meals, a shelter for men, and helping people navigate the treatment system.
Right now, I'm on the urge of getting my birth certificate and my ID so I can get on methadone maintenance because I am still a heroin user. And I've been on heroin now for almost 10 years and I'm tired of being tired.
We probably are the city's largest referral source of drug and alcohol programs.
Prevention Point began 20 years ago as the city's needle exchange, providing clean needles, known as Works on the Street, to IV drug users to prevent the spread of HIV and hepatitis C.
We have been able to bring the HIV incident rate in this city from around 50% back in the 90s, now down to 5% for the last 5 years.
That exchange still operates and is a major draw for the 7,000 people Prevention Point serves each year. But those needles are serving a second purpose, an opportunity to warm people up to recovery.
Originally came here for needle exchange. And then I slowly saw the different types of referrals, different types of programs, things that they could link you up with and stuff like that. So I'm like, wow, it's kind of positive. There's other things going on. And, eventually they kind of get you in that state of mind where they can help you do other things.
Mike Gellock takes advantage of several programs Prevention Point offers, and he knows there's a path to recovery, but isn't ready.
It's just that I still enjoy heroin. I'm sorry to say that to people, but I'm not telling people to do it because it's the stupidest thing you could do. But I'm at a point where I enjoy doing it. I just don't want to die from it, so I think I need to stop doing it.
What we're trying to do is keep people alive so eventually they can get better and they can recover. Because, as I'm fond of saying, you can't recover, you can't get into recovery, you can't get better if you're dead. So if you die from HIV, if you die from Hep C, if you die from an overdose, you can't go through recovery.
Michael Vasker spent nearly 20 years addicted to heroin and cocaine. Prevention Point helped him get back on track along with Suboxone treatment. Now, he volunteers at Prevention Point.
I try and do the best that I can and be as real as I can for other people, okay? That's the only way it's going to work for them. A lot of people here know me, they talk to me, they come up.
The needle exchange serves as a way to reduce harm by preventing the spread of disease. And now, Prevention Point has put another tool to work to save lives, naloxone. The overdose reversal drug, commonly known as Narcan, is doled out for free to clients.
So today's training hopefully will get you the information that you need.
And Prevention Point leads the charge in training organizations, like these staff from recovery houses in Philadelphia, how to use the medicine.
To date, I've educated in the Philadelphia and the surrounding counties. I've done 350 families so far. I tell people, especially families, that there was a time in this country where we used to teach about the need to have smoke detectors and fire extinguishers. Unfortunately, in most cases now in most families, you also have to have a Narcan kit. Especially if you know for a fact that you have a family member that is using opiates.
With all the work they do, Prevention Point sees there's much more to be done. There's not enough stable housing and treatment, and it's still too hard to get people into spots that are available, says Jose Benitez, Prevention Point's executive director.
the best time to access treatment is when you're asking it of me, right? In your motivational moment. If I can't deliver that within a couple of hours, I think it's disabling people.
Prevention Point successes are also tied to their location. Being in the community that needs your help makes a difference.
When you show up there and you say, hey, we're here to help, we're Prevention Point, the look on people's faces is just precious and priceless. They're like, holy moly, you came out here to take care of us? We're like, yeah, that's what we're here to do. That buys you street cred, and that buys you just the kind of credibility that money can't buy.
A notion that Mayor Jim Kenney agrees with.
The clinics that treat people, no one wants them in their neighborhood, but all the people who are addicted to the substances are from the neighborhood. So it's a hard balance in trying to get the clinics there and the help to the people where they live, as opposed to making them come downtown and receive their treatment here.
Prevention Point recently relocated from basement offices on Lehigh Avenue to be closer to clients. The new location offers more opportunities for expansion. But first, Prevention Point is going to listen to the community.
Figuring out what people need and to continue to sort of push the overdose prevention piece that we think is sorely lacking public funds, and figuring out how to help policymakers sort of make better decisions on what direction they need to go in.
In Kensington, Vince Latanzio, NBC 10 News.